Good evening. Welcome to the Leader's Edge. Tonight, we have a well-known personality, radio, TV, in demand to talk about the current crisis. And of course, tonight we focus on keeping the workplace safe. Our speaker today is a master in occupational health and of course a medical technologist, a doctor of medicine, and even a nurse. He is able to juggle his time with so many activities, including work and studies, because he continues to study. Tonight, I am so honored and very proud to present to you Dr. Renato Noy Joseph to discuss with us how do we keep our workplace safe from COVID-19. So, Doc Noy?
Thank you very much, Ms. Dinah, for that kind introduction. And in fact, this is a very timely discussion that we were having, how to prevent or keep the workplace safe from COVID-19. Before we go into the discussion proper, let me just give you some orientation for audience on occupational health, of which I am a specialist on. Occupational health is a branch of medicine, actually, or health sciences that deal with three aspects: the work, the worker, and the work environment. For me, it's very timely and appropriate to apply the current pandemic in the workplace setting in terms of its preventive measures. Because we know for a fact that majority of the population, wherever we go, all parts of the globe, people are working, people have their own jobs to keep. So therefore, it's very important that we control in a way the pandemic through the workforce. And the company management has a responsibility on this aspect, at the same time getting the benefit of having a productive and efficient workforce. So we will focus our discussion on the workplace. Ms. Dana?
Doc Noy, I was wondering, can you run us through a quick sort of quick glance at what have we done in the past that were right and what were wrong, and currently what are we doing right and what are we doing wrong, and of course which will bring us to the future. What then should we do to make it all right? Of course that helps, right? So just a quick run through in the past. What were the things that we did right and what were wrong?
Yeah, very relevant question. Because Miss Dinah, it's very important to bear in mind that what went in a very correct manner was the way the international agencies and our national government had implemented the measures that are based on science. The COVID-19 pandemic has a science on it. In fact, all things should be done in a scientific manner. And the researches are coming up left and right from the World Health Organization, Centers for Disease Control and Prevention in the US, to guide people on how to do things right correctly to prevent the further worsening of the pandemic. That was one good thing. Number two, early on, the international government and international agencies with the respective governments of the different countries have implemented effectively the public health measures. Of course, that to include the wearing of a mask, the social distancing, the other things such as building the resistance of the person and letting the people know, better understand the effects of the pandemic in their health and wellness. I must say there are lots of good things. Go with that also would be the not so good things that had happened. For example, the false information or the fake news that have been pervasive in the social media that I was not comfortable with. So it's a good news also that because the Facebook and other social media platform are with us, so they also have the authority or the privilege of banning this people, the people who are anti, for example, anti-vaccination of COVID-19. Facebook did that and also reinforced some measures so that people will not be confused. Remember, people speculate if they lack information on COVID-19. They search for all information, and sad to say, many of this information are not backed up by science. So, with
Yes.
regard to good things, moving forward, talking about the workplace, it is very important that the company management should take a very good lead in terms of the advocacy, putting up bulletin boards wherever there are. The companies who could afford an e-broadcast mail. In fact, I remember one company that I worked for in not so long ago when I came in the Philippines. They have this electronic switching off of the computer. The employee could not start his daily or her daily work without doing some 15-minute exercise before the start of his or her work. So that's good. And of course, the campaign on healthy lifestyle, which would build up resistance to fight off COVID-19. What are the other things that probably we must not do? Would just very basic or must do, just very basic, always do the measures against COVID-19 that would be based on science. And I think we will never go wrong.
Doc Noy, there were several, well, at least two to my mind, pointed out by some critics that we have been very slow in testing and contact tracing. In the past and even now, we are still not able to come up to the standards set by WHO. So would that be something also that you believe could be a trigger to the higher cases now?
On the testing part, I must say that the very thing that must be improved on is to institute the proper timing of the testing. I know of companies who do testing for their employees every week. And for me, it's really great an expense for the part of the on the part of the company. Though the science of COVID-19 testing states that the testing should ideally be done on the fifth day from the symptom would set in from an individual. Probably the question would be, how about those who are suffering from COVID-19 yet they are asymptomatic? So this is where the advocacy of the company should come in. The COVID-19 pandemic is a team effort. It does not entail only one person, one community, one country, but it entails the cooperation of the whole world. That's why it's called a pandemic. This pandemic, you see, will not be solved without the cooperation of everybody. The COVID testing should be done, and again, in a scientific manner. It's not just like doing it right, left and right. Because you see, the companies are already suffering in terms of their finances. And then when they invest on things that are not really based on science, they're just wasting the resources. An example on this would be the putting on of ultraviolet irradiation in the workplace. That to me is more of an expense, or even putting air filters, which are not really proven to be effective in controlling the virus spreading. It's more of the science of the HVAC, the air conditioning unit, the heat ventilation and air conditioning system of the company. The companies who do have the luxury of having their workplace in proper ventilation and with appropriate air conditioning unit should see to it that the airflow is measured within the constant normal so that the virus will not thrive at that, and there should be a good exchange of air outside the environment. For small workplaces like the small and medium workplaces who could not afford a company-wide air conditioning unit, it is very much recommended to rather put on or open the windows and have fresh air from inside. In this way, ventilation, which has been proven by studies from WHO and CDC, that COVID virus is less likely to survive in well-ventilated areas. So these are some examples of practical measures that any company would like to implement in their workplaces.
So, would you say, Doc Noy, that a hot issue now confronting everybody is to vaccinate or not to vaccinate? What do you think about that?
All right. A very good question, very relevant because the reason why I'm strongly advocating this vaccination because the pandemic will stay if herd immunity will not be achieved. By herd immunity, we mean that at least 70% for COVID-19 should be vaccinated. When a person, when the population reaches a 70% target rate on its vaccination campaign, that would mean that the virus, the SARS-CoV-2, would not be able to survive anymore because people who are vaccinated are protected from being a recipient or a host for the virus. So therefore, the virus will naturally die. That's why we need to campaign on this herd immunity impact. Because as the World Health Organization would put it, no one is safe until everybody is safe.
Oh, I see, I see. Well, there are some, well, they have various reasons, right? Who refuse or really don't want to be vaccinated. Can you give us some pertinent examples of why it's still critical and really crucial to get vaccinated anyway, even if, for example, you have underlying conditions and you are thinking, oh my gosh, I'll get worse if I get vaccinated. What do you think, Doc Noy?
All right. Let me address your question in two parts. First is the benefit of being vaccinated. The case fatality rate or the people who die of COVID-19 is pegged at 2%, and that is worldwide. That is the average, meaning out of 100 people who are diagnosed to have positive for COVID-19, two of them will die. That's a lot of people. That's a big number. Whereas the vaccination side effect, which is proven the most dreaded side effect, which is anaphylactic shock, is only pegged at a very low case. For example, the study of Pfizer BioNTech, out of 1 million people, only 11 cases were recorded to suffer from anaphylactic shock. So simple mathematics will tell us that uh, comparing the two scenarios, being vaccinated and dying of COVID-19, it's but logical to go being vaccinated. All right. The number two item is about people who are having chronic or dreaded diseases. These are people who are immunocompromised, meaning the diabetic people, the people who have cancers, leukemia, etc. All the more that we encourage these people to be vaccinated because they would be saved from having dying from COVID-19. See, these people are already immunocompromised, and once COVID virus will get into their system, all the more that their death rate will be increased. So therefore, we must encourage that these people should be vaccinated. And by the way, this includes also the elderlies. In COVID-19, the elderly is defined as those who are at 65 to 70 years old, because science have proven that the immune system of these groups of people are already down to the level that they could be easily affected or infected with COVID-19.
All right. By the way, Doc Noy, there's one item that has constantly befuddled me, and that is our children or the younger people, they are not as easily infected. And so where does the level of higher infection start in? middle age or in the elderly, and the children not so much. How can you tell?
All right. The statistics worldwide would reveal that the peak of infected people are those which are who belong to the 18 and above age up to 35 or 40. All right. The scary thing is these people, including the young children, tend to be asymptomatic. Despite them harboring the virus, they do not manifest symptoms. And what happens is when they go home or get in contact with some other people, they tend to mingle with each other, not realizing that they could as well infect the people around. So this is just scary. So this is where advocacy would come in again. We will start home, in our very home. Parents should recognize the importance of the children be educated on the infectiousness of COVID-19. So goes again back or going to the workplace, it is important that the employees be informed that be mindful of the COVID-19 infection, emphasizing that even though they are asymptomatic, they are capable of infecting others as well.
By
Okay?
the way, Doc Noy, of course you can tell people are have already gotten what we call affected by cabin fever. I mean, it's been too long. It's over a year now. So there are many people. In fact, our very own government has lifted restrictions. For example, you don't have to ask for authorization anymore to go to different provinces. That was required before. And now, if you get some necessary papers, you can now travel. And so, how sure can one be if you really want to travel? And does quarantine really work? Yeah, like you have a test and then you'll be quarantined. How does that work really?
All right. It's very important to maintain the very basic principle of maintaining the distance. All right, and that is set at 1.5 meters to 2 meters away from from each other, and that is has been proven to be scientifically effective because you see the virus could not reach the other person at that distance anymore. And those with that is the fact that in terms of gatherings of people, it is strongly recommend to hold gatherings in open spaces and
Oh,
open areas rather hold meetings in closed places. Whenever a meeting or a certain gathering is decided to be held in closed area, make sure that the air conditioning unit, the ventilation system becomes very efficient for the virus not to survive in that kind of environment.
wow. I mean, yeah, that is so critical to know. I'm so glad you mentioned that. Now, regarding the carelessness sometimes of some of our kababayans, to sometimes they are gathered together and they take off their mask, and I've seen people even outside in the streets, they're supposed to have mask, and then they put on a shield, but you know what, they put up the shield like that. So as a result, even here in my neighborhood, somebody got infected, and like overnight, only have or just an overnight stay, because his case was not even severe, but oh my gosh, he was slapped with over 1 million from one of the big hospitals here. So isn't that something to be keenly aware of, knowing that it's not that easy to get a hold of millions nowadays?
Yeah.
You also know some people who had to
Yeah.
pay through the nose when they
Yeah,
got
just this morning, I was in Quezon City with my sister there, and a friend who is a doctor at a private hospital spoke of a 8 million hospital expense incurred by a COVID patient. And of course, this happened in a 3 or 5 star hospital facility. That is really a lot. But Miss Dinah, what comes into my mind is the issue of people's survival. They just don't they're just, especially the CND people, the CND population, they're mindful of how to survive with their economic, capabilities. So they don't mind really having this disease, because what they know is to find a living for a daily sustenance for their family. So what I'm pointing out is it's a cultural issue that the leaders of our country or our community should further beef up, because we cannot just change the mindset of people overnight. It has to be generation on generation to change their mindset. And that is really a very big challenge that the government is facing, how to inculcate among the minds of people the expenses that they would incur in case they would be confined because of COVID-19. And realistically, and this is a fact, that the government's funds are already losing out of the budget. Good that PhilHealth is still spending a lot for COVID-19 patients, but until when can we survive that kind of scenario? Probably what we can do is still to enhance further the communication and let the people understand, come up with a definite communication media or a friendly reminder for these people to impress upon them the importance of self-care to prevent COVID-19.
One thing also, Doc Noy, is that not all companies, not all organizations have the same protocols or have the same safety measures for their people. So what do you recommend would be a standard, ideal way of helping to keep their people safe?
Basic principle of designing a health program for companies, is to have a good profile of the workforce, especially this COVID-19. We know for a fact that different age groups are impacted differently by COVID-19. So if the workforce consists of elderlies, it would be a different program compared with a workforce that consists of a younger women, younger people. So that's very important. The other important element here is I must recommend that management be surrounded themselves with experts on COVID-19. Example, COVID-19 psychologically affects people in terms of their psychological makeup. So that a good company is one that probably could hire a psychologist, an expert on addressing psychosocial issues. Because come to think about it, people who are not happy, the worker who has a COVID-19 member of the family sick at home would not be productive. Not to mention that that person, that member of the family, could be a potential person to infect the company as well. So if we look at the bigger picture, it is very important to look at the concept of how COVID-19, I keep on emphasizing the science of COVID-19 would impact the workplace. And from there, design a program to specifically address the issues. In terms of the different industries, for example, the BPOs, the contact centers, they have a different workforce, right? Compared with people working in gas companies or service companies. So we must also consider the hazards that are concomitant to the workplace exposure of the employees. It's very important to have a walkthrough survey of the whole company and address the COVID-19, because these workplace factors play an important role in contributing to the health status of each and every worker.
Doc Noy, I noticed something. One of the when I go, for example, to the banks, and even this is also common in restaurants, even in malls, people seem to have the idea that if you have like what we call our acrylic barriers, something like that,
Mm-hmm.
and then of course they have masks, that will already keep them safe. So will that really work? Okay, I have a mask on, and then acrylic barrier here. Is that enough? You know, the acrylic barrier with the mask. Because, for example, in restaurants, okay, one table, two, and then there's a barrier there between the two of you, but you take off the mask when you eat. So
Mm-hmm.
is that good enough?
The use of a mask with a face shield on has been studied to be 95% effective in preventing the transmission of COVID virus. So that's a study. However, in workplaces that provide a plastic barrier, like a simple plastic, transparent plastic material, would not serve its purpose. You know why? The amount of air that goes into the workplace and the circulation that goes with that is impeded because of the presence of this plastic barrier. So we do not really recommend this, especially
Oh,
those workplaces which are congested with people. It would be much better to maintain a open air circulation. The air inside should be replaced as frequently as possible, and there is a measure to that. There is a gadget or an equipment that will measure the amount of air exchange inside the workplace. Because science again of COVID will tell us that the virus will not survive in a good ventilated area. All right, talking about eating in a restaurant. This is the value of keeping a safe distance of 1.5 to 2 meters when you are eating in a table. So maintain that distance from each other, and for sure the virus will not be able to survive in that distance between two people.
yes, and probably avoid speaking loudly where
Oh yes, that's important. Good that you raised that. In fact, in public transportation, there is, I know, but I think it's lack of posters inside the vehicle that people are not supposed to talk when inside the vehicle during this pandemic. All right. And because we know that by talking, we are spreading the virus through the saliva. Okay?
indeed, indeed. Yeah. So talking of the vaccines, of course, so let me get back to that, because even now I know there are still some really hesitant to be vaccinated. Would you say it doesn't matter how old you are, what kind? It's still you still recommend that highly for everybody.
Yes, especially when the final results of the study dealing with the elderlies. Just recently, I think last month, that the study on the effect of these vaccines to the elderlies have been preliminary released. So it's good that the researches are ongoing. Probably this is not to scare our audience. Yesterday, for example, there were two cases of clot complications happening with one kind of vaccine. But I came to monitor this development this morning, and I learned from a reputable or credible source that there is no correlation between the clot formation and the vaccine that was given, because the researchers preliminary concluded that this is a normal occurrence of the clot incidence among normal population. What I mean is, even if they have not been injected with the vaccine, that is a normal percentage of the population that would die because of the clot problem. So
Oh, I see.
this is very
Okay,
important. Oh,
there is no, Doc Noy, there is no known case at all of somebody who died because he was vaccinated. Nothing.
yes. To tell it in a to rephrase my response is, of all the complications and side effects, there has not been there has been no strong correlation between the complication and the vaccine that was injected, the vaccines that were injected to these affected individuals.
All right. So, Doc Noy, because we are about to end, but before we end, I really want you to announce how people can get in touch with you, how corporations who need consultants to help them follow the proper safety protocols. Can you please provide us, can you please the email address that they may get in touch with you?
Sure. And before I go into that, before I give my information, it's very important the company should understand that the inspection done by the Department of Labor, by the Labor Inspectorate, will proceed as usual, especially when the situation stabilizes, so to speak. Incidentally, my friend is one of the assistant directors of the Bureau of Working Condition, and she emphasizes the fact that companies should put their resources to the right programs because the Department of Labor would come to monitor and track their progress in as far as the implementation strategies to prevent COVID-19 in the workplace. And this discussion of ours is very timely. The management should instill in their minds that they will be inspected and audited on the compliance on making sure that the workplace is safe for the employees. So in case that people will be interested from the talk that we are having now, I would give my email. My email address is renato.joseph, spelled as Josef, at yahoo.com.ph. So for those who would be emailing you, your office, the Speakers and Trainers Bureau, we must welcome them, and you just send me their concerns or clarifications regarding the talk, and I would be very glad to help them out.
Doc Noy, what would be your final, before we say goodbye to our audience, what would be your pointers or challenges to our viewers from your nuggets of wisdom?
All right. Thank you, Ms. Diana. Thank you again for having me here in your show. It's a privilege indeed and an honor for me because our discussion focused on the importance or the role of the company for the workers. And based on the fact that majority of the population are workers, very important that the company should have a program in place to address the COVID-19 pandemic. And one of the very thing that the companies could start is surround themselves with a team of experts on the science of COVID, not only on the exact science, but the social sciences that would include the psychologists to help their people on the psychological makeup of being an effective and productive, efficient worker. The advocacy campaign should also be in place, led by the company who is in charge of the media relations, because we have to address the number two issue in the world in relation to pandemic, and that is the fake news brought about by people who just want to have trouble in solving this problem. And number three thing is not only on these programs that I've mentioned earlier, let us also remember, Miss Dinah, to include the spiritual aspect of COVID-19. I missed saying, telling the audience that I myself is a COVID-19 survivor. I almost lost my life in Saudi Arabia. In my old life, I rely all things on science, on the different science, being a graduate of four health and medical sciences, without factoring in God. But since I survived in July 2020, all my life, every minute of the day, I always ask God to guide me, despite me a survivor, because we know that being a survivor does not give you the chance to not to get COVID-19 again. In other words, let us rely on God because this pandemic is the overall champion guiding us is God, despite the sciences that go with COVID-19 pandemic.
Thank you so much, Doc Noy. I really I'm so grateful. I'm full of joy that you accepted our invitation, considering your tight schedule. And after all, you are constantly being invited to radio programs, TV shows, to also give these tips and guidelines for people. And I'm so glad that you did this for the Leaders Edge. Click, like, share, and subscribe to the Leaders Edge channel by SEASTDI in YouTube. And remember, learning is a never-ending journey with limitless vistas. Good night, everybody.